So he goes and he talks to the neuro and he comes back and he has me do like one quick test where you have to like touch your nose and touch his finger. He's like, can you swallow? And I'm like, yeah. Not that I'd eaten anything really, but I was like, yeah, I think I can. Which now I know is the sign for the stroke and stuff. So he was like, well, I talked to the neuro and I think you're just having a panic attack. It's like a really rare form of a panic attack. They call it conversion disorder. Threw the packet at me and was like, we'll get you on some anxiety meds and then send you home. So we waited for more and more hours, like 2 to 3 more hours, just sitting there. And we're like, you can't just give us the pill and send us home. And he was like, no, we're trying to get you a room. You have to take it here. We have to watch you. And I was like, what? Only for like the 3 hours to pass. And they were so slammed. He was like, so do you guys want us to just give you the pill and then send you home? And we were like, what the fuck, dude? We just asked you that and you said no like an hour ago. And that was it. We were like, are you fucking kidding me? And he literally gave us the prescription, and we went home. We were sent on our way after they checked my heart and they drew some blood and they made me touch my nose and touch a finger. I was so irate. I was livid because no one was listening to me. No one was actually taking this seriously, that I didn't get any of the scans. They didn't address anything regarding my breathing issues. And it was to the point where it was only on one side and I couldn't lay down flat because I was literally suffocating. I had to stay propped up. It wasn't both of my lungs. It was front and back on my right side. And everything was brushed off like, well, you just had surgery. Like, I don't know what to tell you. You didn't have a stroke. And that's kind of what began this huge struggle. Is it only got worse in the couple days after that. No one was listening to us until my surgeon set up an MRI like 2 days later to check. So my surgeon set up a brain MRI for like 2 days after that. So like 4 or 5 days post-surgery to check for a stroke in any minute little detail. So we did that. I got the MRI. I got more blood tests drawn. Everything was coming back normal, which is great. I didn't have a stroke, but it didn't explain why the fuck this was happening to me. And I am very neurotic and I do have anxiety on a normal, every day-to-day basis. So I like get hyper fixated on things, and I was like, there has to be an answer. And I know in the research for conversion disorder, that's part of it, is like, you have to be very clear with the patients because they're going to want an answer. It's basically a ghost of a diagnosis. Nothing's actually wrong with you, but your brain actually tricks itself into presenting as a neurological issue when no damage or injury has been done. So it's very frustrating.